Yeah, we're in Semichem in Kirkcaldy to try and raise the awareness of public access defibrillation. There's roughly about 25 cardiac arrests happen throughout Scotland on a daily basis, and the more people we can educate on how to do simple skills like deliver CPR until somebody can arrive with a defib, it's going to have a massive impact on the people that we're saving.
Well, public access defibrillators can quite literally save somebody's life. If somebody's having a heart attack, then if they can access a defibrillator within a few minutes, then their chances of survival increase dramatically, and somebody in the community properly trained can be delivering that treatment while an ambulance is on its way. So I think it's good to have these defibrillators in busy community areas like this one, and I'm sure they can have a big impact and help to increase the chances of survival of anybody who's suffering a heart attack.
Somebody needs to phone the ambulance service to get us on the way during a cardiac arrest. Somebody needs to get on that patient's chest and deliver chest compressions. And the third element is somebody needs to get there with a defib. And if that happens within about 4 minutes, the person's chances of survival are about 40 to 60%, which is absolutely massive. So if a member of the public does come across a cardiac arrest and phone for help, we can advise them where their nearest public access defib is so they can go and collect it.
All the staff in store have been trained. We've had a course on how to use the defibrillator and CPR, and how we would respond if somebody had had a heart attack. It's really useful, and the machine that we have is portable. Scotland's got a really high rate of people having heart attacks. I think it's fantastic that the stores have got the defibs in and that we've had training.
I think it's great that the ambulance service and Scotmid are working together on this. I'd like to see public access defibrillators available in many more parts of Scotland. They supplement the role of the ambulance service. They don't replace the role of the ambulance service, but if somebody who's having a heart attack can be given access to a defibrillator managed by somebody who's got the appropriate training in using such a machine, then they can be getting life-saving health treatment while the ambulance is on its way to them. So I think that's something that is to be welcomed and encouraged.